Video 1. How to save someone having a heart attack. Busy street or home, someone suddenly clutches their chest. Camera zooms on worried faces. Stay calm and act fast. Signs of heart attack: sweating, chest pain or pressure, breathing heavily. Pain may spread to the arm, neck, jaw, or back. Cut to medical animation showing a blocked heart artery. Other signs include nausea, lightheadedness, and sudden weakness. Emergency step. Call your local emergency number immediately. Give clear symptoms and exact location. Dispatcher faint in background. Friends state symptoms and location. Ask others to help and guide responders in. Keep the line open and follow instructions. Keeping calm. Loosen tight clothing and improve airflow. Wipe sweat and help him relax. Keep him seated, still, and calm while help is on the way. Ask about medications, allergies, and bleeding risks. Giving medicine. If not allergic and fully awake, give aspirin if advised. Friend. Dispatcher, is aspirin okay? Dispatcher. If not allergic and able to chew, yes. Offer an aspirin tablet. Patient chews it slowly. Only use prescribed nitroglycerin as directed. If he becomes unconscious and is not breathing normally, check breathing quickly, then start CPR. Place your hands on the center of the chest. Push hard and fast, allowing full chest recoil. Aim for 100 to 120 compressions per minute. Switch compressors every 2 minutes if possible. Use an AED if available, and follow voice prompts. Ambulance arrives. Rescuers take over care, share what happened and what you did. Calm music, the saved person smiling weakly. Save a life, learn first aid.